What was your most memorable experience while you were president of the ASDS?
The most memorable experience as president was association with the leaders of dermatology, people like Ed Cruel, Roger Seeley, and visiting with them socially and getting to know them as close friends.
What were the most pressing issues at that time that faced the society?
The major issue was that the American Society for Dermatologic Surgery was still early in its phases and had not gained great recognition, but was on the way to getting great recognition. And so this occurred during the time when I joined as a member and to the time that I was president.
What were the most significant innovations that were going on within the dermatologic surgery?
The most significant innovation or change was the rise of Mohs micrographic surgery to be accepted by the entire physician population for the treatment of skin cancer, malignancies of the skin.
And in your career, do you have a most memorable patient that you can think of?
I was in private practice of medicine here in Houston, and all my patients were memorable. It's been about 30 or 40 years, and I can't identify any one individual, but I had very good patients. They were very loyal and excellent in dealing with them.
If you look back on your career, would there be anything that you would change?
Would not change a thing. The only problem I had is that I was involved in too many societies at the time, the AMA, the Harris County Medical Society, the TMA, ASDS, and the American Academy of Dermatology. So being in private practice and raising a young family, really, I think, spent too much time on the political aspects of medicine, but it was enjoyable and we survived it.
And what advice would you give today's young dermatologic surgeons?
I would use the theme that I used when I was president of the Academy, that patients always come first. And so listen to the patients, see what their problems are, then try to tailor a treatment for whatever their dermatologic problem might be. But one of the main things that I think we needed to do is to listen to patients and have them feel that we really cared about them.
Do you have any predictions for the future of the ASDS?
I think the specialty has gained great recognition. Dermatologic surgery has become established, and I think we'll continue to do well and to serve patients well. The only problems we have now, of course, are we're in the middle of a pandemic, an epidemic, and it challenges us to be able to deliver good care to patients. But I think that the prediction is that we're going to continue to prosper and serve patients well.
So what advice do you have for the ASDS leadership in serving its membership in the future?
It's been one of the themes of my life. I feel like I have a servant attitude, servant mentality, and I think that we really need to put the patient's concern ahead of everything else, rather than worrying about the financial aspects of the practice. We need to be concerned that we're delivering the best dermatologic care to our patients, some of whom are close friends. Many of my patients, since I practice in Houston, I went to school with from elementary all the way up to medical school in Galveston. So I think our major concern is to deliver the best quality dermatologic care that we can do so.